Heart failure is known to impact the patients starting from their 40s on an average, and it continues to affect them till the later years of their life. A lot of patients, despite medical therapy and despite doing all the right things, it is not just medicines, but things like losing weight or stopping smoking or, trying to be more active, exercise, addressing sleep apnea, in spite of that, continue to have symptoms. We have a robust armament of medications and procedures that aim to improve heart function. And when patients do not do good, in spite of all this, they continue to have symptoms. That is when these devices come in place. The device is named Barostim. It's a nice word. It just means baroreceptor stimulation. UFL Health was the first to actually, place this device in the state of Kentucky. It's supposed to lead to improved, walking distance for some patients or improved symptoms. So patients are able to actually walk better and can, do their simple tasks through their day with more energy. When we assess these patients prior to a procedure, we actually do some testing to see how much they are able to walk and whether their oxygen numbers are optimal, and then we compare it by doing a similar evaluation after the procedure. From weeks to months is where you would expect a difference. In terms of performance, it is just like a pacemaker, wherein at some point when the charge on that gets low, we just replace it as you would replace a car battery, for example. We are a great team. When you have cardiac surgeons or cardiologists, heart failure physicians who are all on board, constantly engaging with themselves, with each other, and also with patients, then you can make a difference